Hello, everyone, and welcome to Heads Up, the weekly video podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, chronic daily migraine survivor, and founder of the Facebook group Migraine Nation. I am here today with someone totally awesome. This is Ashley Hattle-Clemenshaw. Hi, Ashley. How are you?
Hi, I'm good. Thank you for having me.
Thank you for being here. We're super excited. So Ashley is a survivor of cluster headache who we have not had anyone with cluster on yet. So I'm so excited to talk to her. Ashley is also the author of Cluster Headaches, A Guide to Surviving One of the Most Painful Conditions Known to Man. So can you show us your book cover? Because it's beautiful. I want everyone to see it. That is Ashley's book. It is on Amazon, correct?
Yep, it's available on Amazon and ashleyhattle.com.
All right, yes, so everyone can go look that up, and we are going to talk a little bit about the book later. But I wanted to start by talking a little bit about cluster headache, because I do think that not everyone understands cluster headache. So recently, Dr. Martin and I, on an episode of Heads Up, talked about the medical background to cluster headache a little bit. So Ashley's here to tell us what it's like to live with cluster headache. This recent survey data that was presented at the American Headache Society meeting ranked cluster headache as, in fact, as Ashley says, one of the most painful conditions known to man. People ranked it as more painful than gunshot wounds, childbirth, labor, stab wounds, just about anything that you can imagine. And if you've ever witnessed someone having a cluster headache, they, as opposed to some other pain conditions where people lay there and are really miserable and you can see how horrifying it is, cluster people seem to react differently. They will dig at their eye or rock or even bang their head against the wall. And it is termed a suicide headache. It's a very different headache than some of the other headaches we cover. So cluster headache is a form of trigeminal autonomic cephalgia. And there are a number of headaches that fall under that title. These headaches are one-sided pain, and they come with cranial autonomic symptoms, which include tearing, nasal congestion, runny nose, sweaty forehead, and some different things that come along with them. So I wanted to start to do Ashley's story, which is really interesting. And I wanted her to go ahead and be able to start from the beginning. And what's interesting about her story is her first experience with trigeminal autonomic cephalgia wasn't actually a cluster headache. It was a different type of headache. It was called SUMT, which is short for something very long, which is called short-lasting unilateral neuralgiform headache with conjunctival injection and tearing. And the reason that conjunctival injection and tearing is in there is you'll notice that people that have these types of headaches often will have a red eye. Sometimes it's swollen. And this is because the vessels in this area will get agitated and swollen. And so that's why that term is in there. So just to clarify for some people. So Ashley, let's get to you without further ado. Can you please tell us what this first experience with this type of headache was like for you?
Okay. My first SUMT experience or attack, I'm not quite sure the correct phrasing. I was a lifeguard and I was 17 years old working a summer job. And one afternoon I was sitting up on the lifeguard stand and this immense pain came on, and it was right here. And I tried to blink it away. And before I could really register how actually painful it was gone. Right. And so I thought nothing of it, and I carried on. And then it happened again the next day at the same time. And that carried on for maybe a week and then went away.
Okay. How did your cluster headache episodes, how did they progress after that?
Well, almost exactly a year later, while I was working the same summer job in 18, I felt that familiar pain, only it didn't go away after 10 to 15 seconds. It stuck around for, I think, 90 minutes. So it again came on quickly and peaked within a few minutes, and it felt like something was stabbing me behind the eye, and I called over to the other lifeguards and asked somebody to come relieve me. And I went into our employee room, which wasn't very private at all. And my boss was telling me, okay, lay down, here's an ice pack. And I couldn't really do that. As soon as I laid down on the cold cement, it would hurt so badly that I would jump back up and end up rocking back and forth.
Mm-hmm. Can you explain to us what, not just that one time, but in general with your experience with cluster headache, what does a cluster headache feel like to you?
It feels like an ice pick stabbing right behind my eye right here. And I would describe it similar to a brain freeze. Mm-hmm. So, when you chug a slushie really quickly, only it doesn't go away after a few seconds. It sticks around for up to 3 hours, but mine are typically about 90 minutes.
Okay.
You can't sit still. It's like, you can't even think during an attack. It's just so searing, and it's like there are no original thoughts outside of this pain is so immense, I wish I could just pass out from it.
Right.
Or die.
Right. Okay. At what point did you seek medical attention? And what's kept you from going earlier?
Well, when it was sunked, I really thought nothing of it because it was just a few seconds, once a day for a week or so. But the next year when it was cluster headaches, I don't know why I didn't go to the doctor. Like, it was this awful pain that came on crazy quick. You'd think I would go to the emergency room, but I didn't. And I was supposed to move to college 2 weeks after that. So my dad got me in to see a neurologist, and that neurologist actually diagnosed me right away. And even though the attacks had stopped, he started me on prednisone, which can stop a cycle as well.
Right.
But he didn't really explain clusters to me. I thought, sweet, I am cured. This has been awful, but it'll never come back again. But 6 months later, it did.
Okay. And I think you told me a story of one of the episodes and you woke up like in a frenzy.
Yes. So that was the second cycle, which was December of 2007.
Okay.
Crazy how specifically I remember the dates.
Yeah.
But I woke up, like you said, in a frenzy in my dorm room and was crying and screaming and like whimpering. And I woke up my roommate and said, I need you to take me to the ER. I'm having one of those cluster headaches. And she took me to the ER, and we got there fast enough for them to see the attack, but not soon enough for them to actually treat it. So I was saying, I have cluster headaches, this is what this is. And they responded with migraine.
Right.
And they gave me hydrocodone and sent me home.
Okay. Tell us about some of the frustrations you've faced as a person who experiences cluster headache, trying to get help from the medical community.
It was, especially being a young adult, newly out on my own, learning to navigate the, new doctors, the pharmacy and medications is already hard when you're a new college student, but to have such a debilitating condition that I didn't understand, it was a lot of emergency room trips that were pointless and expensive. Like that ER visit I just mentioned, I was back there the next day saying this hydrocodone doesn't work. They treated me like I was seeking pain pills, and I got the message, don't come back.
Right.
And so it was just a lot of frustration and crying and feeling so defeated that I was the only one who wanted me to feel better.
Right. Okay. And then how about appointments with like general practitioners or specialists that weren't in the emergency room?
Well, I'll tell you about the most notable one. So when I was re-diagnosed with cluster headaches about 6 years later, it was at a notable neurologic institute. And in the span of 2 hours before I went to see the neurologist, 3 or 4 nurses told me, you can't have cluster headaches because you're a woman. They kept talking about migraine attacks. And I said, no, when I'm in a cluster, when I'm in a cycle. And 30 seconds in the room with the neurologist, he again, like the first one, said, yes, you have episodic cluster headache.
Okay.
So it was very frustrating that the nurses and ER personnel were dismissing me because of my gender.
Right. So can you explain that really quick for people who might not know? When you say a cluster cycle, how does cluster work? Explain these cycles that they come in.
So there's chronic and episodic cluster headaches, and I'm episodic. And it's a peculiar disease. It comes on every 6 months for me. It seems to be around the equinoxes. And at first they were 2 weeks at a time, which was manageable. And then they grew to be 2 to 3 months at a time.
Right.
So I was out of commission for up to half the year at one point.
Okay. So you did tell me, I find this very interesting, and you mentioned it a little bit just now. You started to just agree when people would say, try and tell you had migraine, because you would just say, I don't care what you call it. Please just treat it. I can relate to that because up until I was probably 17, I mean, I had migraine from the time I was a toddler, and everyone just told me I had sinus headaches. And I would say the same thing. I don't care what you call it. Fine, call it sinus headache, just fix it. Right. So I can fully understand that. How long do you think you did that? Just called it migraine.
I did it for probably 1 to 2 years.
Okay.
The people close to me knew that it was cluster headaches, but it was just such a chore, and it still is sometimes, but I try to explain it when I have time.
Right.
Such a chore to argue with everyone about the semantics.
Right.
I had a legitimate diagnosis that even medical people were dismissing.
Right. And what medication were you offered? I think you already said what they gave you the second cycle, right? So the third cycle, the third time you had a cluster cycle, what did they offer you?
So the third cycle, they offered me oral sumatriptan. And it was the right medication, but the wrong form, because it takes way too long. The oral does give me a preventative effect, so it would stop an attack from happening. But if I took it at onset, it wouldn't do anything. So after that, I graduated to the nasal spray, which worked a little bit better, but still not fast enough. So it took another cycle before I was finally given the injections of sumatriptan.
Okay. All right. So when you were finally prescribed the correct therapy for cluster, what was it? Was it just sumatriptan injections, or was there more to it? Is that when they also gave you oxygen therapy?
It actually took another 3 years for me to get oxygen therapy.
Okay. So can you explain oxygen therapy and why this is correct, and why cluster patients do this and where you do it, etc.?
Yeah, so oxygen is actually the most effective treatment and the first line treatment. So for me, it was very frustrating that it took me 6 years to get it. And so the issue that some doctors and oxygen suppliers and insurance companies have is that we need a high flow. It can't be an oxygen concentrator. It can't be a nasal cannula.
Right.
It has to be a high flow with a non-rebreather mask. You have to hyperventilate on it.
What is the flow rate that is needed for someone with a cluster headache?
At least 12 to 15 liters per minute. Okay. I have a smaller tank that goes up to 25.
Okay.
And some doctors worry about oxygen toxicity, but unless you have a pre-existing lung condition, it's not an issue. And we're using it for less than 20 minutes at a time.
Okay. And do a lot of people with cluster have a tank like you have behind you in their house?
Oh yes, because this tank may last me 10 to 12 attacks.
Okay.
At my worst, I can have 4 attacks a day.
Okay.
So this big one is maybe going to last 4 days at my worst.
Okay. And does your insurance company pay for your oxygen?
No.
Okay.
Which is very frustrating because there are 250 published studies on oxygen and cluster headaches,
Right.
and still it's not covered.
Right. Okay. So I wanted to jump ahead and ask you, with everything you've been through with your cluster diagnosis and how difficult it is to have people understand your cluster diagnosis, what made you decide to write a book, and what exactly is in your book?
I've always been a researcher. I have been writing in journals ever since I can remember.
Mm-hmm.
So as soon as I think when my cycles grew to be about a month is when I really started to get desperate and
Mm-hmm.
really started to search for more information.
Right.
And it was so frustrating because I went to Amazon, because we get everything from Amazon. And I bought 3 books, and one book only mentioned cluster headaches in a sentence, another only mentioned cluster headaches in a paragraph,
Mm-hmm.
and the other one was just a bunch of quotes with no additional information.
Right.
So I decided that I was going to write the book that I really needed when I was diagnosed, because there's so much information, there's so much misinformation, that having it all together can save you so much grief and so much unnecessary pain.
Right. Okay. Show us your book one more time, and please tell me the title. Tell us all the title so that people can look it up. There is kind of a glare, so you're going to have to say the title.
Oh, it is Cluster Headaches, A Guide to Surviving One of the Most Painful Conditions Known to Me. So Cluster Busters is a nonprofit organization that I found when I started researching cluster headaches to write the book.
Mm-hmm.
And my first experience was a patient conference. They do one every September in 2014. And I showed up with a camera around my neck and a big notebook full of questions. And, I was expecting your typical medical conference.
Right.
That is absolutely not what it was. It was, I cried for 2 days straight.
Oh.
But it was an incredible, like crying in awe of the validation that I didn't even realize how much I was craving the validation of just other patients and meeting other people who have been through this and survived it and are navigating the world. So everything I learned, I really learned from that conference and conferences after that. And it's actually how I met my husband.
Oh, wow. I actually did not realize you guys had met at Cluster Busters, but Ashley's husband also has cluster headache and is an awesome person and advocate for clusters. So we probably should also have him on the podcast at some point. Okay, well, thank you so much, Ashley, for coming on. That was an extremely informative episode, and I hope everyone learned something, and I'm sure they did, because I think that cluster headache isn't talked about nearly enough. So there's so much to learn. And so this is Ashley and Lindsay signing off of this week's episode of Heads Up, the weekly podcast of the National Headache Foundation.